We learned of another 675 cases of COVID-19 reported today across the state of Indiana. We've now learned more than 23,000 Hoosiers have tested positive for the coronavirus. And we want to show you this graph that shows you the rise that we've seen in cases every day. And as we've heard from the state health commissioner, they do expect to see more cases soon.
We have looked at many different models, and all models say that as you open things back up, no matter how careful you are, you will have more cases. The point of opening up gradually is to make sure that we had everything in place, tracing, contact tracing, that we had the testing that we needed across the state, that our hospital systems were where they needed to be from a staffing and a PPE standpoint, that we knew that we were capable and ready and able to respond immediately.
We also learned today that Indiana received its first shipment of the drug remdesivir. The state health commissioner says it was sent to a hotspot, but she did not say which one. This is a drug that's been used to treat illnesses like MERS and SARS and can help COVID-19 as well. The state also expects to release preliminary results sometime early next week, and this would come from that testing that was done by the Fairbanks School of Public Health. Recently, they tested more than 4,300 people statewide, chosen at random. The goal is to test about 20,000 people in phases over the next year to try to figure out what portion of Indiana's population is infected with COVID-19 or has previously been infected. Well, we know that this is infecting and impacting so many of us, especially our businesses now suffering. And now we're getting just a better idea of just how bad the economic crisis really is. This is new numbers coming in now from the Labor Department saying more than 20 million people lost their jobs last month. We are now at 14.7% unemployment rate. That's the highest since the Great Depression. Hoosiers, no exception. Lauren Kostick shows us how many now are still trying to get back on their feet.
Well, it started to slow down, and they started letting people, laying people off.
Like a lot of people, David Lanford found himself unemployed back in mid-March after the economy took a hit from COVID-19. He spent almost 10 years working at the Indy 500 grill at the airport before filing for unemployment.
I've waited 3 hours, got hung up on, waited 3 more hours, and finally got through to somebody.
And still no money, staying at a motel for the time being.
It put me on the streets is how bad it hit me.
And Indiana's unemployment website says it's easy as 1, 2, 3. But Gidget Hayworth, a nail technician out in Southport, tells me it's anything but easy.
It was just one thing after another trying to get it all done.
After filing 3 different times, Hayworth was finally approved. As of Friday, a payment showed up in her account, but the money is still not there. She is told it could take 2 to 3 business days to process.
We all expected to wake up this morning and see money in our account.
Hayworth is planning to go back to the salon on May 18th, feeling grateful she still has a job.
Fortunate, I have a husband, so I'm not a single mom or a single lady. So I'm okay.
And 25-year-old Katie Harris is in a similar situation. She recently started a new job at a travel insurance company. 7 months later, she was laid off.
I just went to the bathroom and I just started crying.
Never being in this position before, Harris didn't know what to do. She filed for unemployment, but hasn't been approved yet because of an unresolved issue.
A claim investigator is supposed to give you a call if there's an unresolved issue or something that they need further information on. And I haven't heard from anybody.
Harris is constantly looking for a job, but many companies tell her they aren't hiring.
I'll probably be able to last for another month. But after that, if I don't have any other income coming in, it's over for me.
We know a lot of people who are at high risk are really worried about going back on the job and wondering if doing so would be safe for them. They don't know right now whether or not they qualify for unemployment. The state is hearing these concerns and today said they are going to handle these claims, but they're going to have to do it on a case-by-case basis. Right now, working with the Department of Labor on how to do it the best way. Well, let's talk about an institution here in Indianapolis. It's not surprising that many businesses like Shapiro's Deli are requiring their workers to get tested for COVID-19. But as with any of the current tests, when you take this test, it only allows you to know your status at the time the test was given. And that's not the only concern with the tests out there right now.
Under HIPAA, the employer can't be told what the results are. It's a confidential test.
Now, Shapiro says obviously employers trust their employees are going to notify them if they have tested positive for the virus, but he does feel that more needs to be done to share information to better contain it. Scott?